21-year-old female is brought to you by her mother for evaluation. The mother states that the patient's eyes are yellow. This has been progressively worsening over the past 2 months. She also noticed her belly is getting bigger. On exam, the patient is jaundiced with abdominal distension and shifting dullness. Neurological exam reveals a resting tremor and an unsteady gait. Labs are below. WBC counts 8,000, hemoglobin is 12.1, platelet counts 350,000, T-billy is 6.8, AST is 212, ALT is 300, ALK-Phos is 33, hepatitis panel for A, B, and C are all negative. Which of the following is most likely to be found in this patient? And welcome back to MedComplete Board Review. So for our patient, the 21-year-old female with transaminitis and a hand tremor, the answer is D, low ceruloplasmin with high 24-hour urine copper excretion. So a couple of things we need to know about Wilson's disease, and this is Wilson's disease, right? So the age of diagnosis usually is very young. So it occurs in patients between 5 and 40 years of age. The median age of diagnosis is about 13 years of age, okay? Whenever you're suspecting Wilson's disease, the first thing that you have to do is get a ceruloplasmin level. So ceruloplasmin is that protein that carries around the copper, it binds it. And the problem with Wilson's is if there's not enough ceruloplasmin, the free copper starts to deposit into tissue, and that's how you manifest disease. So in order to, the first thing you want to do is get the ceruloplasmin. It's low in about 90% of cases. And if it is low, then you want to confirm with a urine copper excretion. Serum copper could have been here and it would have been wrong. Remember, serum copper is not predictable of disease because all of the serum copper is depositing into tissue, so it's hard to get an accurate measurement. But the 24-hour urine copper excretion should be high in these patients. Remember, because there is free copper floating around, the urine copper excretion will be high, okay? In case that you ever see in clinical practice like an elevated ceruloplasmin level, don't be alarmed by that. Ceruloplasmin is similar to other proteins that could be elevated in inflammatory states, or you can think of it as like ferritin, for example, where during an infection or like an acute phase reactants type of situation, it could be elevated. So having a high ceruloplasmin is not really indicative of much, but a low ceruloplasmin should raise suspicion for Wilson's disease. Now, the other thing that you need to make the diagnosis is you should obviously send these patients for a slit lamp exam to look for Kaiser-Fletcher rings. Now, they're not always present in patients that have just transaminitis but no neurological symptoms, and sometimes you can just have liver involvement in Wilson's. Only 50% of those patients will have Kaiser-Fletcher rings on slit lamp. But once they develop neurological symptoms, the Kaiser-Fletcher rings are almost present in all those patients, about 98 to 100%. Their neurological symptoms can vary significantly. So here we put a tremor and an unsteady gait, but it could be dysarthria, it could be psychiatric issues in these patients. So it's not just limited to this. But the most common place of deposition tends to be the basal ganglia and the cerebellum. So usually they have some ataxia and some neurological deficit if it reaches the brain. All right. Hope you found this helpful. Please leave your comments in the section below if you have any.